Composite bonding. Who wants it? Who needs it? From our patients to our dentists, composite bonding is probably everyone's favorite treatment. So we're here today with composite wizard, Dr. Ian, to talk about it and ask some of the most commonly asked questions. You ready?
I am ready.
Okay, will we start? The first one is, whoa, who saw that coming? What is composite bonding?
So composite bonding is a procedure where we layer white filling, which is composite, over your teeth without shaving and to improve the aesthetics of your teeth.
So that's why people love it. It's just for aesthetics, it doesn't hurt. It's a fun treatment.
It's non-invasive.
And it's fun.
Very fun.
How long does composite bonding last?
So I would always say 3 to 5 years because everyone's different, everyone's habits are different. Composite bonding is like getting a car. You know, you don't really know how long it's going to last, but if you take care of it, it's going to last.
And if you go to a good supplier.
Yes.
And you do your NCT.
If you get it checked every now and then, get a service, it's going to last a long time.
Does composite bonding hurt?
It does not, because we do not drill your teeth, which means we don't need to provide anesthetic. So it's basically us filling over your tooth.
Okay, so you can sit back, watch Netflix.
Put on some Netflix, Spotify.
What's the thing most people watch?
The Office or Friends. That'll be the go-to.
What can composite bonding fix?
It could fix a couple things. The most common ones will be people coming in with very worn or chipped teeth from years of grinding or some trauma. But it can fix, let's say, a discolored tooth. We can layer over the whole thing. That'll be called a veneer. It could fill in any gaps that people might have. Let's say if you're not keen on getting braces or Invisalign to close your spaces, in certain cases, composites can close it for you.
And so it's not a world apart if you're going between composite bonding and composite veneers. You can kind of decide that as you go.
It really depends on what the patient wants. So I always try to listen to what the patient tells me, what they want their final smile to look like, and then from there I'll be able to plan, okay, which one suits the patient better.
Wow.
It's a long one.
I know, it's a fancy way of saying pros and cons. What are the benefits and drawbacks of composite bonding?
So benefits: improve aesthetics, more confidence in your smile, wider teeth, more even set of teeth, wider smile. Drawbacks, just like anything in dentistry, you have to take care of it. Nothing, unfortunately, doesn't last forever. So we don't make promises that it will last a lifetime, unfortunately. And that's why you have to take care of it. So that obviously you have to be active in making sure it's taken care of.
And do you think a lot of people come in and they're surprised with how much it can fix and how quickly?
The reason why people come in for composite bonding is how quickly it can be done. If you get a full smile, it can normally take about 3 hours or maybe less, really depending on the case. So it's pretty much instant, which is why it's so popular.
And what's the average amount of teeth people get?
8, because it covers the whole smile on the front, but also a little bit on the side so that the composite blends in well. So at least when someone smiles from the side, people can't really tell you had them done because it doesn't stop halfway in the side.
We get a lot of people on Facebook saying, can I have a full mouth of composite bonding? And I try and explain it the best I can, but how would you explain it?
I always say just come in for a consultation because we can discuss so many more things on it. I can see your teeth better, how it suits you, because not everyone gets the same amount of composites all the time. Everyone is different.
But you don't need composite for your back teeth, really.
It depends on how far the smile reaches, how many teeth you show.
If you're like an Anne Hathaway, like full, she needs them on all teeth. Okay, I'll tell her. How do I care for my bonded teeth?
So brushing and flossing is normal, so treat them like your own teeth. Go into the hygienist or the dentist every 6 months to get them clean and polished. Normally after you get the bonding, we'll give you a retainer or a night guard to wear at night time to prevent any clenching or grinding forces on them so they last longer. And those same retainers that we give you, you can use the whitening gels that we have given you before when you start whitening to maintain the shade of your teeth to slow down any stains.
Nice, so you get your whitening before bonding?
Yeah, normally you do whitening before just to kind of get the color right so that we can match it to that bright color.
Yeah. Is composite bonding reversible?
To some extent. If you get composite bonding, we never shaved your teeth from the start, but once the composite is on, if you want them taken off, hopefully not, but one day if you want them taken off, we have to physically remove the composites, which do stick very well to your teeth and sometimes are very difficult to differentiate what is tooth, what is composite. I always say, look, it's like getting your nails done and getting them taken off. When the technician does it, they have to get this device to physically remove it, and sometimes it can hit your tooth, form a few scratches and some dents. So I always say expect up to 5% of damage, but we always polish it over.
And make it look nice.
Yep.
Can I pick a different color composite for fun?
You can, but that's on you because once the composites are done, the risks with taking it off, as long as you're aware of the risks.
If I'm like, I'm going to Wicked and I want half pink teeth, half green teeth, and I want them to glitter as well.
Not a problem. I'll just make sure they don't stick so that in case something happens, we can always take it off.
Not a problem, but you'll judge me.
Yeah, I will judge you.
I love it.
I mean, I'll judge you right away.
I DIY my composite bonding at home? Asking for a friend.
You can, but will you? Probably not. I don't know why anyone would do that. They're gonna have to figure out how to do it on themselves, which is very difficult because it's already difficult enough to do it on someone else. So they're gonna have to have a lot of training for that.
Could you do composite bonding on yourself?
I was thinking about it just to test it out, how I would feel about it, but it never came to fruition.
Oh my God, you should please try it for a video.
Maybe one day, yeah.
Will my composite bonding make my teeth glow under a UV light? It's the question we've all been wondering.
They will.
Really?
Yeah. I've seen photos of it.
Okay, so just your composite, not the rest of your teeth?
No, like if you get a full veneer, then the whole veneer would illuminate.
Yeah.
But if it's just the edge, then it'll just be the edges, yeah.
So you'll look like a little kind of like white and beige lava lamp?
Yeah.
Cool effect.
I think you'll be blue, yeah.
How often is one under a UV lamp, really?
It depends on how often they go out, I guess, right?
Okay, so worth noting, your composite bonding will glow. Do you have anything you'd like to add about composite bonding?
To be honest with you, everyone is different. So everyone, I try to, when you come in for the consultation, I make sure that you get what you want and what you ask for. And I'll do my best to get that. So it's all about that first appointment to make sure we have a chat to discuss it. And then we'll take it from there. And I hope you trust me to do that for you.
Trust Ian. He's the best. Guys, those were the most Googled questions about composite bonding. Thank you for watching with us. If you'd like more videos like this with experts like Dr. Ian, you can subscribe below. See you later.